pulse you have to read, right? So now we have understood this aortic pressure wave and ventricular pressure wave we have understood. Now our job is to understand the changes in the pressure at the level of this atrium. So atrium pressure changes. So atrium pressure changes means this is nothing but typically the description of the jugular venous pulsation. Okay, so you all know that whenever you say JVP, okay, that is nothing but reflection of the right atrium pressure, okay. If you record the pressure changes from the left atrium, similar kind of wave will be seen. Okay, what I am saying, first try to understand. If I record the pressure changes from right atrium, I am going to get a curve like this, okay, which will be known as ACV wave. I will discuss. And if you are going to record the left atrium pressure also by some means, left atrium pressure is generally recorded by a technique which is known as pulmonary capillary wedge pressure. Pulmonary capillary wedge pressure. This is a technique by which left atrium pressure is recorded. You will also get a pressure changes of left atrium like this, where you are going to get ACV wave similarly, right? But the difference between these two, right atrium wave and left atrium wave, is that in case of right atrium wave, A wave is the dominant one. So I am writing here A dominant, right? And in case of left atrium pressure change, if you record, this is V wave dominant. So here the V is the dominant wave, right? The reason is because of this, the left atrium is a stiffer, harder chamber than that of the right atrium, because of which the V wave is more dominant in case of left atrium pressure changes, and A wave is the more dominant wave during the right atrium. Otherwise you are going to get the similar kind of wave in both the atrium. So if you record the pressure from right atrium, okay, what are the different waves that you are going to get? Okay, so A wave, C wave, and then you are going to get a V wave, right? So x-axis, this is the time axis we have already discussed, and y-axis is the pressure axis. But which pressure we are recording? We are recording the atrium pressure. So you are getting some positive wave, A wave, C wave and V wave. These are known as the positive waves. So I am writing here positive wave in the right atrium pressure, A, C and V. And then you are also getting some negative wave, like here this is X, then this is X dash, okay, and sorry, this X dash I should write clearly, this is X dash, and then this is Y descent, right? So when the waves are going towards a lower direction, that is the negative or descent. So I am writing here, these are the negative waves. They are X, X dash and Y. Negative wave are also known as descending wave, right? So remember like this, A means atrium contraction. So A wave is due to atrium contraction. A wave is due to atrium contraction. We are looking at the right atrium pressure changes. So try to imagine a diagram like this. This is your right atrium and this is your right ventricle. Okay. Now we are looking at the atrium chamber. So A wave is due to atrium contraction. So when the atrium is contracting, so it is very, very obvious that the atrium pressure will rise to a very high level, and that rise of atrium pressure during atrium contraction is nothing but the A wave. Getting my point? So A wave is due to atrium contraction. Now if I ask you, A wave is produced in the right atrium pressure wave, but which phase of cardiac cycle is going on during A wave? So your simple answer, A wave means atrium contraction. Atrium contraction corresponds with last rapid filling phase of cardiac cycle. Am I clear? This is very, very important, because nowadays they will give question combination of this thing. Okay, so last rapid filling phase correspond with atrium contraction. So whenever there is atrium contraction, atrium pressure is rising, that you are getting at the level of A wave. And if you look at the ventricle, last rapid filling phase is going on in the ventricle. Okay, means the blood will reach to the ventricle during this A wave. Okay, now after this atrium systole, okay, so now atrium is contracted. Now what is going to happen? Now the atrium will go for relaxation. So whenever atrium is going for more and more relaxation, what will happen to atrium pressure? Atrium pressure will start dropping down. So now the atrium pressure will start dropping down. So during atrium relaxation, the atrium pressure will start dropping down, and this dropping down of pressure is here. So this drop down of pressure is known as the X descent or X wave. So X wave, I am writing the cause of this X wave is relaxation of the atrium chamber. Relaxation of atrium chamber. Now I can understand that during this X descent, ideally the wave should fall or reach back to the baseline. Atrium pressure should reach to the lowest point during this point, but that is not happening. Suddenly there is appearance of a notch, followed by there is appearance of a positive wave once again, positive wave once again. Why this is happening? To understand that, you have to look at the ventricular chamber, right ventricle. So this is my right ventricle. Atrium contraction is over, last rapid filling phase is over. After the last rapid filling phase, we all know the total volume of blood which is present in the ventricle is end diastolic volume. After the end diastolic volume, what phase of cardiac cycle will start? The ventricle will start contraction, and that phase is known as isovolumic contraction phase. So isovolumic contraction phase means at the beginning of this isovolumic contraction phase, what is going to happen? This tricuspid valve is going to closed, and then the ventricle will contract. More and more contraction means there will be increase in ventricular pressure. When the ventricular pressure is increasing, what will happen to these tricuspid valves? These tricuspid valves will bulge towards the atrium cavity. This will bulge towards the atrium cavity like this. Getting my point? Look at this diagram. So during the isovolumic contraction phase, because of ventricular strong contraction, the tricuspid valve is bulging towards the atrium cavity, although it will never open up towards the atrium cavity normally, because the chordae tendineae are there which is attached with these valves. They will pull the valves, but there will be little bulging of the tricuspid valves towards the atrium cavity. So whenever the valve is bulging towards the atrium cavity is compromised. So what will happen to the cavity pressure? There will be little rise of cavity pressure in the right atrium, and that little rise of cavity pressure here is C wave in JVP or C wave in atrium pressure. So I can understand that C means this is C stands for cusp, and what is happening to the cusp? There is bulging of cusp. Okay, cusp bulging towards right atrium cavity. Right atrium cavity. This bulging of cusp is happening during which phase of cardiac cycle? Your answer, this is happening during isovolumic contraction phase. So getting my point? So this C wave in the JVP or C wave in the right atrium pressure curve will be generated during isovolumic contraction phase of cardiac cycle, right? Now, after the isovolumic contraction phase, what phase of cardiac cycle will start? You all know that at the end of isovolumic contraction phase, there will be starting of ejection. Ejection means there will be opening up of the semilunar valves. Semilunar valve open up means the blood will be ejected here. When the ejection is occurring, do you think this tricuspid valve will still remain bulged towards the atrium cavity? Answer is never. But due to severe contraction of the ventricular chamber, okay, so imagine like this, that the ventricular chamber is contracting to a very severe degree. Ventricular chamber is contracting to a very severe degree like this, okay, towards the pulmonary artery. What will happen? This tricuspid valve will also pull towards this ventricular cavity like this. There is pulling of the tricuspid valves towards this ventricular cavity like this. So whenever the tricuspid valve is pulled towards the ventricular cavity, which is happening during which phase of cardiac cycle? During this ejection phase of cardiac cycle it is happening. You look at the chamber of this atrium. The atrium chamber has increased, volume is increased. Volume increase means what is going to happen to the pressure at the level of this atrium? I can easily understand the pressure at the level of atrium will decrease. That decrease in pressure is denoted here by this X descent. So this X descent is due to enlargement of the right atrium cavity. And why the enlargement of the right atrium cavity is happening? Due to pulling of tricuspid valves, due to pulling of tricuspid valves towards, okay, towards right ventricle. Getting my point? This pulling of tricuspid valve is decreasing the right atrium pressure further, and that is X descent. So I'll wipe this out. So now I can understand, after the end of X descent, the right atrium pressure to a very low point. And this X descent was happening during which phase of cardiac cycle? During the ejection phase of cardiac cycle this was happening. Okay, right. Now the atrium pressure is to a very low point due to full relaxation of the atrium due to pulling of the tricuspid valve. When the atrium pressure is very low, look at, when the atrium pressure is very low, what is going to happen? Okay, this atrium will suck the blood from the superior vena cava, okay, as well as inferior vena cava. Because the atrium pressure is very low, it is dragging the blood from superior vena cava, it is dragging the blood from inferior vena cava. This returning of blood from IVC and SVCs towards the right atrium, this is known as the venous return phase of right atrium. This is known as the venous return to the right atrium. So whenever more and more blood is returning to the right atrium, what will happen to the atrium pressure? It will rise gradually, and that rise of pressure gradually at the level of atrium is denoted by this wave, that is nothing but my V wave. So V wave means it is nothing but gradual rise of atrium pressure due to returning of blood to the right atrium cavity. So I can say that is nothing but venous return. So I am writing here V stands for venous return, okay, to right atrium from SVC and IVC, and that is rising the pressure to a very high level. So this is the peak point. So this is the V wave, right? So V wave means now the right atrium pressure is high. So if I ask you, the V wave is generating during which phase of cardiac cycle? Okay, so after the ejection, what phase of cardiac cycle is there? After the ejection, there will be protodiastole and then isovolemic relaxation. So during this protodiastole and during this isovolemic relaxation, the V wave in the JVP or V wave in the right atrium will be created. Now, at the end of this V wave, atrium pressure is very high. Now you look at this chamber, okay, atrium pressure is very high here, right, due to filling of atrium. And what is the status of the ventricle? Ventricular isovolemic relaxation is done, because I told you when venous return is going in the right atrium, what is happening to this ventricle? Ventricle is going for isovolemic relaxation. Isovolemic relaxation means at the end of isovolemic relaxation, ventricular pressure is 0. So due to venous return, atrium pressure is very high, and due to isovolemic relaxation, ventricular pressure is very low. That is happening at the end of V wave, that is happening at the end of isovolemic relaxation. Now what is going to happen? All of you know, now this tricuspid valve is going to open up due to pressure difference. And whenever tricuspid valve is opening up, we all know that the blood will run towards the ventricular cavity, that will leads to starting of ventricular filling. But you look at atrium chamber, what will happen to the atrium pressure? Because the blood is coming from atrium towards the ventricular cavity, atrium pressure will drop down, and that drop down means decrease in atrium pressure, and that is nothing but Y descent in the right atrium. Okay, so Y descent is nothing but due to opening of tricuspid valves. Whenever there is opening of tricuspid valve, ventricular filling is started. That means if I ask you why descent is happening during which phase of cardiac cycle, your answer will be first rapid filling phase as well as during this diastasis phase. There will be more and more dropping of atrium pressure, and that is Y descent. But I am not writing the last rapid filling phase, because whenever there is starting of last rapid filling phase, this is the atrium contraction phase. Whenever atrium will contract, again there will be generation of which wave? That is nothing but A wave. Means again we will be reaching here, that is A wave. So that's why remember this Y descent is happening due to opening up the TV, tricuspid valves, and that is happening during which phase of cardiac cycle? Passive filling phase of cardiac cycle. During active filling phase of cardiac cycle, the A wave in the JVP will be created. Getting my point? So this way you have to remember the difference wave in the JVP, the positive waves and negative wave. So positive wave are A, C and V, and negative wave are X, X dash and Y descent. And I told you how to read JVP along with cardiac cycle. Okay, otherwise you will not be able to corroborate. Right? So if you read like this, then you will be able to understand that A wave is due to atrium contraction. So if there is atrial fibrillation, atrium is not able to contract properly, then you are not going to get this A wave. Right? So this way you can understand the pathology in a better way. So now if I want to plot this A wave in this original diagram or Uyghur's diagram. Okay. So tell me, I want to plot the left atrium pressure wave in this Uyghur's diagram, left atrium pressure changes. So again I am going to get A, C and V wave. So where the A wave will be there in this diagram, where the C wave will be there? Start thinking. So C wave is created during which phase of cardiac cycle? Isovolemic contraction. So note down, during this isovolemic contraction, I am taking a color. Which color I will take? This. So A wave will be created here. Okay. Then there will be creation of a C wave during this isovolemic contraction phase, right? Then what will happen? There will be descent, and then we know that during this ejection, the descent will continue, and then the venous return will start. Venous return will rise the atrium pressure, and at this point, the atrium pressure is going above the, so here, this is the peak of the V wave. This is the peak of the V wave, right? This is C wave and this is my A wave. I hope you are understanding. Okay, I will show you the book diagram, but this way you have to understand the JVP wave or left atrium pressure wave if you corroborate in this Uyghur's diagram. So this is A wave, atrium contraction, then C wave during isovolemic contraction, then during ejection phase there is decrease in atrium pressure, then due to venous return atrium pressure is rising. At this point, atrium pressure is more than ventricular pressure. Look at what is the phase. This phase, if you look at this line, this is nothing but end of isovolemic relaxation. End of isovolemic relaxation means ventricular pressure is 0 mm of mercury and atrium pressure is very high, that is a V wave. So what is going to happen if I ask you that at this point what is going to happen? Your answer will be that this will leads to opening of mitral valves, because we are drawing the left ventricle. This is opening of mitral valves, right? And mitral valve closure will happen at which point? Closure will happen at the onset of systole. Onset of systole means this is the point which is onset of systole. So this is the point where there will be closure of mitral valve. Okay, so this is closure point of mitral valve. Getting my point? So now if you look at this is the closure point of the mitral valve, means this is the first heart sound, right? So this is my first heart sound, and second heart sound, this is the closure point of the aortic valve. This is the second heart sound, right? Okay, I hope you are understanding. And this is the opening point of the mitral valve. Okay, so in this diagram, okay, now this becomes more and more complicated. I want to draw my ECG, right? So ECG means we know that first heart sound that is going to produce at the peak of the R wave. So I have to draw the ECG diagram in such a way that P wave, then Q, this peak of R wave is corroborating with the first heart sound, then S wave, okay, and the end of T wave has to corroborate it with this second heart sound. Okay, so this is T wave, so almost this is corroborating with the second heart sound. So this is P and this is nothing but my ECG, right? Getting my point? So now if you look at the whole diagram, so we have plotted the aortic pressure curve, right? This is the aortic pressure curve, we have already discussed. We have plotted the ventricular pressure curve, okay, that will rise like this and then it will fall like this, okay. And we have also plotted the atrium pressure curve, that is nothing but ACV. What diagram this is? This is nothing but Uyghur's diagram, I told you, right? So now after understanding all these waves, if you look at the diagram from book, okay, so this is a diagram I have taken from book, Uyghur's diagram, okay. So in this diagram, could you follow this aortic pressure curve, okay? So this is the aortic pressure curve, broken line, right? Aortic pressure curve. Could you follow this ventricular pressure curve, this solid line, this is the ventricular pressure curve, right? If you look carefully, whatever I told you, you will be able to get here also. This is aortic, ventricular pressure curve. And if I ask you, look at the atrium pressure changes, so A wave followed by C wave followed by B wave, you are finding out here, right? And here this ECG is also plotted, R wave, T wave, everything is plotted. Another diagram, similar kind of diagram. So now this is more clearer, right? More clearer, okay. So again you are getting the ventricular wave and atrium wave, everything. So this is the typical diagram of Uyghur's diagram, which is given in book. Now in this Uyghur's diagram, one thing I have to understand, that is QS2, okay. So I'll go back to my diagram, okay, here, okay. So what I'm saying, QS2. So Q is the Q wave and S2 is the second heart sound. That is the simple meaning. Q is the Q wave in the ECG and S2 is the second heart sound. So if you record the second heart sound by a phonocardiogram, so S2 is recorded by a instrument that is known as phonocardiogram, okay, recording of the heart sound, that will record the amplitude and time duration of the sound. And this Q, this is recorded by ECG. So this QS2 is known as electromechanical systole. This is known as electromechanical systole, right? So starting point of the Q wave, okay, up to this S2, this duration is known as QS2, which is known as electromechanical systole. Electrical systole means depolarization. Where from the depolarization is starting? The Q wave, that's why you are taking the Q wave. And ending of depolarization, ending of systole means when the semilunar valve is closed, that is the second heart sound, right? So that's why if you look at, this is the second heart sound point, that is the end of systole, and beginning of electrical systole is the Q wave. That's why this QS2 is taken as the electromechanical systole. Now within this electromechanical systole, you remember that QS2 is equal to 2 part pre-ejection period plus left ventricular ejection period. I will tell you. Left ventricular ejection period, where from the ejection is starting and where from the ejection is ending. It is very simple. If you look at the aortic pressure curve, how to record the aortic pressure curve? By carotid pressure transducer. I can easily understand that this is the onset point of ejection and this dicrotic notch or the second heart sound, that is the ending point of ejection. So beginning point of ejection is here and ending point of ejection is dicrotic notch. The time duration between these two is known as left ventricular ejection period, right? So in this Uyghur's diagram, if I ask you which one is the left ventricular ejection period, your simple answer will be that from this to this, left ventricular ejection period, from the opening of this semilunar valve up to the closure of this semilunar valve. That is the actual left ventricular ejection period. So before the left ventricular ejection period, the time duration of this QS2 segment is known as pre-ejection period. I told you pre-ejection period means this onset of Q wave up to the onset of this ejection. This will be known as the pre-ejection period, right? Getting my point? So ideally, your left ventricular ejection period is calculated first and QS2 is calculated first. How to calculate the QS2? QS2 is taken from onset of Q up to the S2, and then left ventricular ejection is calculated by this aortic pressure curve, and then if you subtract this QS2 minus left ventricular ejection period, you are going to get the pre-ejection period. So this is known as pre-ejection period, right? Onset of QF up to the opening up of the semilunar valve. Why we are calculating this too? Okay, because you know that this pre-ejection period upon left ventricular ejection period has a ratio of 0.35, and this ratio is inversely proportionate to ejection fraction of the heart. Ejection fraction we will be discussing in the next classes, but all of you know that. So whenever your ejection fraction is rising, this ratio, okay, what will happen? The ratio will decrease. Okay, whenever ejection fraction is rising, like for example, okay, if you stimulate the sympathetic system, okay, your ejection fraction will rise. If you give this drug like digoxin, okay, your ejection fraction will rise. Whenever your ejection fraction is rising, what will happen to this ratio? The ratio will decrease. Okay, this has been asked in MCQ, particularly the ionized set type of MCQ, so that way you have to look at. Okay, so this is all about the Uyghur's diagram, and we have seen the diagram from book. Now again I am going back to this Uyghur's diagram so that you don't forget this. Okay, now you look at very carefully. Normally aortic pressure and ventricular pressure, they are changing proportionally during this ejection phase, and atrium pressure and ventricular pressure, they are changing proportionally during filling phase or diastolic phase. Am I clear? So aortic pressure and ventricular pressure, if you look at here, okay, there is a little gap between this aortic pressure and ventricular, very little gap, but they are changing proportionally. During which phase of cardiac cycle? During systole. And this atrium pressure, okay, so this V wave is the part of the atrium pressure, and this ventricular pressure, they are changing proportionally during which phase of cardiac cycle? During this diastolic phase of cardiac cycle. This is important. Why? If you want to understand or diagnose different valvular diseases based on this Uyghur's diagram, suppose you have introduced one catheter inside the left ventricle, right? And you are also measuring the left atrium pressure, as well as you are also measuring your aortic pressure by carotid pressure transducer. So you are going to plot the Uyghur's diagram from left ventricle. By plotting this Uyghur's diagram, the diagnosis of valvular disease can be done. Like for example, valvular stenosis, right? So here you can find out aortic valve stenosis and here mitral valve stenosis. So first, aortic valve stenosis. How to look at this Uyghur's diagram and how to diagnose if this is given as an image based question. So this is ventricle and this is arch of aorta, and atrium is here, atrium is here. So this is left atrium and this is my aorta. I hope you get this diagram, right? So aortic valve stenosis means, all of you know that this aperture or this opening of this aortic valve is reduced and the valve is not opening easily. So when the isovolemic contraction is going on, okay, so ventricle is contracting isovolemically, it is generating pressure, but due to stenosis it is not able to open up this valve, aortic valve, easily. So what will happen? The ventricular pressure has to be very high. Then and then only you are going to open up this aortic valve, because that is stenosed, right? So ventricular pressure will be very high during this isovolemic contraction phase, even during the ejection phase, and even after that the ventricle will not be able to eject huge amount of blood to the arch of aorta. Why? Because the valve is stenosed, the aperture of the valve is reduced. That's why I can understand that during this ejection phase as well as during this isovolemic contraction phase, ventricular pressure is rising to a very high level, but aortic pressure is not rising proportionally. There will be a very huge gap between ventricular pressure curve and aortic pressure curve, and that gap will be present in which phase of cardiac cycle? During systole. So you have seen earlier that this is the ejection phase. If you look at This is the ejection phase where ventricular pressure is rising to a very, very high level. But look at the aortic pressure. Aortic pressure is not rising proportionally. Very, very less rise of aortic pressure. And there is a huge gap between this ventricular pressure and aortic pressure during systole. This gap is the identifying feature of aortic valve stenosis disease. Right? Okay. Now, if I ask you mitral valve stenosis, how I am going to imagine? So this is my arch of aorta, this is my left ventricle, okay, and left atrium is here. Now I have to look at mitral valve stenosis, means the problem is arising between left atrium and left ventricle. So I have to look at the left atrium pressure changes and left ventricular pressure changes, right? Because the stenosis is here at the level of mitral valve. So mitral valve stenosis means the blood from this, okay, the blood from this left atrium will not be able to enter in the ventricle easily, means ventricular filling will not be proper. Filling of ventricle is occurring. Which phase of cardiac cycle you are talking of? You are talking of diastolic phase of cardiac cycle. So I have to look at the pressure of left atrium and left ventricle during which phase of cardiac cycle? During diastole. I told you earlier that during diastole, okay, so this atrium pressure as well as this ventricular pressure, they changes proportionally. But due to this valvular stenosis, mitral valve stenosis, atrium will contract, atrium will try to give blood to the ventricle, but it will not be able to give. So what will happen? The left atrium pressure will rise to a very, very high level, but the end diastolic pressure of the ventricle will not rise that much. So there will be a gap between atrium pressure and ventricular pressure curve. So if you find out here, this is the diastolic portion of the curve, this is the diastolic portion of the curve. So during this diastole, I can find out that there is a big gap between this left atrium pressure and left ventricular pressure, and that gap is diagnosis of mitral valve stenosis. So getting my point? So stenosis means I have to look at the gap between ventricular curve and aortic curve for aortic stenosis, and for left atrium and left ventricular pressure curve during mitral stenosis, right? Now if you look at the regurgitation or insufficiency, valvular insufficiency or valvular regurgitations, right? So aortic valve regurgitation, very peculiar thing. So this is left ventricle. The aortic valve regurgitation means the valve is not able to close completely during diastole of the ventricle. Okay, so I have to think of diastole, right? During diastole, what will happen? The valve should be closed completely, but aortic regurgitation means the valve is not completely closed. So what will happen? Some of the blood will fall back from the aorta to the ventricle. That is the basic pathology. So blood is coming back from aorta to the ventricle, as well as the ventricle will get its blood from atrium also. So this is left atrium. Blood will also reach from left atrium to left ventricle. That is the normal filling of ventricle. So one source of blood is coming from atrium, another source of blood is coming from the arch of aorta. What will happen to the end diastolic volume? It will be very, 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 very high. Whenever end diastolic volume increases, I can easily understand that my stroke volume will also increase, right? If stroke volume increases, then systolic blood pressure will also increase. This relationship you will understand better in the blood pressure chapter. I will discuss why the stroke volume is related to systolic blood pressure. But for the time being, you remember, due to increase in the stroke volume, systolic blood pressure will be very, very high, but the diastolic blood pressure will be very, very low because blood is falling back to the ventricle during diastole. So aortic regurgitation means there will be a huge gap between systolic blood pressure and diastolic blood pressure. So if I look at the aortic pressure changes, this curve, so this will be very, very high and this diastolic blood pressure will be very, very low. Am I clear? So this is the identifying feature of this Uyghur's diagram also. You look at this, diastolic pressure is here. It is very, very lower than even the 100 millimeter mercury also. But you look at the systolic blood pressure, it is here. So there is a big gap between systolic and diastolic blood pressure. I can say the pulse pressure will be very, very high, and this is the diagnosis of aortic valve regurgitations, right? Okay, now if you look at the mitral valve regurgitations, okay, so where the regurgitation is occurring, the blood is regurgitated back at the level of left atrium, okay, left atrium through the mitral valve. So this is the mitral valve which is not closing properly, due to which during this systole when the ventricle is contracting, the blood should go only in one direction, that is towards the arch of aorta, but the mitral valve is not closed properly, so some blood is also going back to the atrium. So atrium will get more blood, so atrium pressure will rise, but atrium normally also gets blood from the pulmonary vein. So the pulmonary vein is also giving the blood to the left atrium. So now the left atrium is getting two sources of blood. Okay, one is coming from pulmonary vein and one is coming from ventricle during regurgitation. So what will happen? The right atrium pressure will be very, very high, and this pressure will be high during which phase of right atrium? The filling of right atrium, the venous return phase of right atrium. This is nothing but the venous return phase. The blood is returning from pulmonary vein, but additionally the right atrium is also left atrium is also getting blood from the regurgitation. So left atrium is getting huge amount of blood. One is from venous return, one is from regurgitation. So the venous return wave or V wave in the atrium pressure will be very, 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 very prominent, and that is the identifying feature of this mitral valve regurgitation. See here, the tall V wave, okay, it is very, very high. If you look at this this pressure, okay, so here you can find out the right atrium pressure, left atrium pressure, the V wave, it is near equal to 25, maybe 30, and that will leads to pulmonary congestion also. So this tall V wave in the Uyghur's diagram is an identifying feature of mitral valve regurgitations, right? So this is all about your cardiac cycle along with certain